So I hope you see the PPT.
Yes.
Okay. So we'll start with Lobelia inflata. I remember I have left three drugs which was not taken for the seniors in the last semester: lacaninum, lactifloratum, and lithium cup. I'll take that in coming other classes uh, because I have no doubt I can finish the OM on time, but Materia Medica, it seems so massive, so massive. So I thought, okay, I will take the drugs which you're familiar with so that I can skiply pass through. So let's start with Lobelia inflata. So this is a drug that has been taken for you in the last semester. Anyone can say me what were the symptoms? You forgot this soon? I am not getting any response.
Something about nausea. Like they have like very bad nausea and vomiting, I think.
Yes, true, true, true. How did you get that point, Farah?
I think I did an assignment on this before.
On Lobelia.
Yeah.
Oh, okay. In this semester?
I think isn't it? I think so, miss.
Okay, okay. So the seniors, you remember? Now that she gave you some clue, at least the main sphere of action. Okay, no one is
Mm,
remembering. Huh, yes, Vinod.
No, this one Farah say nausea.
Yes,
So
nausea. Huh.
can I add the vomiting?
Okay, then if you are adding vomiting, then add something else also. Then it will be complete. It will be a three-leg stool.
Um,
Nausea, vomiting. Then what is the probability?
Prostration.
Dyspnea,
Ah,
the respiration.
yes. There will be prostration. There will be extreme perspiration. It will be a coldness, a collapse condition. So when I say all these symptoms, is there any other drug that is coming into your mind?
Retrum.
Veratrum, yes. Nausea, vomiting. Come on, nausea, vomiting. That are prominent
Cockles.
remedies in. Huh?
Cockles.
Hmm,
Is it?
hmm. But more
Arsenicum.
importantly, no. Yes, arsenica. Another snapshot remedy when someone comes to you saying nausea and vomiting. You don't think anything. You just go. I mean, just go and take. It may work. It may not work. But
Coprum.
cuprum, yes. Something with I.
Okay.
Ipecac.
I
Yes, epicac. So we told veratrum, epicac, salb. And what else? Cuprum. Um, and anything else? Another remedy. It starts with T. Tobacco. So there we get a clue about this drug, the nausea, vomiting, which is highly characteristic. And then it will be followed by extreme prostration, cold sweat, etc. But now, when we just compare this with Epicac, Epicac, we know they have this GIT complaint.
Miss Mira?
Uh, yeah, Farah, are you asking me something?
Oh yeah, I just wanted to say that the lobelia it's in your assignment by the way Just wanted to.
Ah, okay, okay. That's what because I have done the comparative material medical for you, know, and I don't remember teaching you lobelia. That's why when you told us, I was like, "What semester did you get that?" Okay. Um, so, so again going back, what we were saying, we now just remember about epicac. In case of epicac, you know there is a very characteristic nausea and vomiting. The GIT symptoms are very prominent in case of epicac, but nevertheless, we shouldn't forget the respiratory complaints also of epicac. That also there is a very prominent cough, whooping cough, and then they vomiting out some white glary mucus. Respiratory symptoms are also prominent in case of epicac. So likewise, in lobelia also we have characteristic GIT symptoms which we mentioned now. We have the respiratory symptoms, which is in case of epicac, it is a constant cough, even whooping cough. Here also there is that constant cough, but more than that, more than the cough, here the characteristic feature will be asthma, very much asthma, and that may even leading to a situation of uh, suffocation. The person is not getting breath. That will be the condition over here. And then some heart symptoms may also be there, which we can see in lobelia. And this heart symptoms, the some of the this nausea, vomiting, and the respiratory complaints we can see in another medicine, that is tobacco. So there is a comparison which we can make with all these drugs. So in short, now when we go to lobelia, we'll see a lot of symptoms, but in short, what I would say you to remember, because lobelia, it's rarely prescribed. I mean, I have not seen someone giving lobelia 30, 200, etc. Even in my college, if at all I have seen a lobelia being given in tinctures. And one of the main indication of lobelia as a tincture is, when we prescribe tincture usually, uh, as I always say, you we take boric, we'll see a lot of clinical symptoms, but it will be mostly one symptom or one word based on which usually these tinctures are prescribed, and how much it will be effective or not, I really don't know about it. Um, but in case of lobelia, if we find respiratory complaints, the asthma, dyspnea, going to a level of suffocation, the respiratory complaint, okay, the respiratory complaint, not for the nausea and vomiting, but the respiratory complaint, the asthma. And if it is seen in corpulent persons, like very fleshy persons, then lobelia is given. So a patient comes to you, and the patient is having some dyspneic complaints. Associated with that, the patient is having some heart complaints also, and then the patient seems to be a bit obese, then a tincture to be indicated at that time would be lobelia. So those complaints seen in a obese person, that is in case of lobelia. Now we'll go to this details. Common name is Indian tobacco, and this name Indian tobacco, it got that name because the symptoms is similar to tobacco. We do have a medicine that called as tobacco. So when lobelia inflator, because of its emetic property, actually it is also having emetic property like that of veratrum, like that of epicac. It is having, and also tobacco. It is having the emetic property, and that is why lobelia inflator is given the common name Indian tobacco. It's belong to the family Campanulaceae, but forget it. Just remember Lobeliaceae. That is more easy. Its non-effect, it contains the alkaloid lobeline, which has similar effect upon the nervous system as nicotine. That is why it is having that symptoms similar to tobacco. It's usually seen in dry soils, meadows, fields, roadsides, etc. And in North America, southeastern Canada, Alabama, Kansas, whatever. The tincture, the preparation is tincture of fresh plant when it is in flower, and also seed trituration of dried leaves. So, in case of lobelia, as I told, it is best adapted to persons of light hair, blue eyes, fair complexion, and inclined to be fleshy. When I say this, which are the other drugs that you remember in case of such a complexion? Such a constitution: blue eyes, fair complexion, inclined to be fleshy.
Carcinosin.
Which one?
Carcinosinum.
Carcinosin. Are they
They
having
also
a
describe
fleshy
they
constitution?
also describe the child with blue eyes, fair complexion,
Yes, but
obedient.
are they having obese constitution, carcinosin?
Yeah, in one of the description.
One of the description, okay, okay, maybe. Any other remedies?
Just fleshy?
Huh?
Are you asking about just fleshy complexion or like
The whole thing, the light hair, blue eyes, fair complexion, and inclined to be fleshy. The common one,
Calca?
yeah, calca. And then there is another one that's also with C. We can also go for actually graphitis, but something with
But
C.
graphite usually come with obesity.
Uh,
Light
capsicum.
hair, light hair is the one that make me think. Light hair. Graphitis also described as light hair.
Not light hair it is, but the other things, the blue eyes, fair complexion, and obesity. The one that I wanted, what's similar to that is actually capsicum. So Calcarea cub and capsicum, similar to that.
Mm. But it didn't
It is
mention whether obesity in that, about this lobelia.
no, in lobelia, the fleshy, that term is very important.
Mm.
That's why when I told you that when it is given in form of tincture, we don't see for much of the symptoms. But when you have dyspnea plus heart complaints plus the patient is fatty, because when we go to India, we can't get this type of light hair, blue eyes, fair complexion. So in India, when the medicine is being prescribed, we don't go for light hair, blue eyes. It will be usually fair and fleshy. Sometimes even the fair complexion is not given that much importance, because the proving is done in European. There's explaining about the European constitution, the complexion and all. But other things like this fleshy, the thin, the other characteristic freckles or something that we can give importance to. Uh, like Calcarea curb and capsicum, I just told because these are the two remedies which we shouldn't forget when it is told that inclined to be very fleshy. If you take Alansky note, you can see the similarity of these sentences in these three drugs. That's why I told. Otherwise, for a comparison, not much important between Calcarea curb and lobelia or even capsicum. But there is a comparison that is told in Allen. Lobelia, it is actually having aggravation from drinking alcohol. So, for the bad effects of drinking in people with light hair, blue or gray eyes, florid complexion, florid, if you remember, that congestive nature, or the red discoloration of the face, corpulent, lobelia bears the same relation that nux vomica does to the persons of the opposite temperament. So the constitution differs, but the action that lobelia is having to a particular one is very much similar to nux vomica to the opposite temperament. And such a comparison have been told in Allen's keynote. You can expect such kind of sentences for MCQ purpose. So starting the symptomatology with Alan Skinner, the constitution we have seen. In them, they have headache, and headache is mostly gastric in nature. That's why one of the comparison with Nuxworm also came. There also we have the gastric headache. There will be nausea and vomiting with great prostration, following intoxication, that is after to the alcohol being taken. And we see the same causation in case of Nux vomica. And it usually starts from afternoon until midnight with sudden pallor and also profuse sweat. And there is an aggravation by tobacco or tobacco smoke, the headache being aggravated by tobacco or tobacco smoke. You remember any other drug where there is an aggravation of headache from tobacco? A very common drug.
Ignacia.
Yes, Ignatia. Yes. And something else with G.
With
Hmm? Gelsemium also. That's also having an aggravation from tobacco smoke. So headache, much similar to that of Nux vomica. The constitutions are different, yes, but the symptoms are almost same. The gastric headache, the nausea, vomiting, prostration, following after like a debauch or a intoxication, especially the alcohol. And in GIT, there is gastric derangement, extreme nausea and vomiting, and morning sickness, especially in case of pregnant ladies. There will be vomiting, and after to the vomiting, as we discussed, the face will be bathed with the cold sweat that we see in Veratrum. This one, the morning sickness that we see in pregnancy, even in the stage of pregnancy, the vomiting will be having the same nature. There will be very excessive vomiting, and then that is followed by cold sweat. There will be profuse salivation also, and in that, it is compared with the drug lactic acid. And I don't know whether you have learned lactic acid. Lactic acid is one of the most important remedy given for morning sickness. And if this morning sickness is having a constitutional tendency or a familial tendency, another remedy which could be considered is sorinum, especially when it is having that miasmatic, deep miasmatic. Otherwise, in case of morning sickness, lactic acid is one of the best remedy. A woman is coming to you in her earlier trimester, the first trimester, with morning sickness, extreme vomiting, some kind of morning sickness will be there, but going to an extreme level where she is so prostrated and covered with cold sweat, and because of that she is not able to eat anything because she's always vomiting. One of the snapshot remedy you can think about is lactic acid. So in case of lobelia, it is the same status of lactic acid it's having in case of morning sickness. It can be chronic also with good appetite. Anyway, the nausea, profuse sweat, and marked prostration maintains. There can be a weak sensation and an indescribable feeling at epigastria, and that is also from excessive use of tea or tobacco. Now, the most important symptom in the respiratory complaints, there is dyspnea, which I told you, and that dyspnea will be uh, the spasmodic asthma or spasmodic in nature and threatening to a level of suffocation. The person will feel a constriction in the middle part of the chest. It really doesn't matter whether the constriction is felt on the middle of the chest because it shows the involvement of the heart complaint also. But it, like in the exam or even in the clinic, it doesn't matter whether if the patient is not able to specify if it is coming right from the middle of the chest or not. But the thing is the aggravating and ameliorating factors. So this dyspnea It is aggravated from least exposure to cold or the slightest exertion or climbing up or coming down the stairs. So, slightest movement, exposure to cold, etc., can increase this dyspnea. But at the same time, there is another symptom that there is a sensation of congestion which is felt in the heart region. So don't confuse with that symptom of dyspnea and also that congestive stage. In case of dyspnea, the person is actually having aggravation from the least motion, the least exertion. Going up and down the stairs is causing a trouble for him. But then, if the patient is having a serious complaint, there is a sensation of congestion in the heart region, as if the blood has all moved to the heart region. Obviously, if the person, whenever we say a stage of congestion, there is accumulation or there is a rush of blood to that particular area. It seems that all the blood from the extremities had reached to the heart region. And at that time, that congestive sensation is ameliorated by rapid walking. Um, and this dyspnea can also be seen during labor. And with every labor pain, with every spasm of labor pain, there is an aggravation. And at that time, the dyspnea is too horrible that it has the ability even to neutralize the labor pain. That's how they had explained. So, from that explanation, you could understand actually how much severe the dyspnea will be. And this kind of dyspnea, which is seen in a fleshy person, and as a tincture, you can think about lobelia. There's a sensation as if heart would stand still. There is a deep-seated pain at the base of the heart. In case of urine, there is a deep orange-red color with copious red sediment, similar to that of lycopodium. And another one is, which is that remedy? Anyone remembering? The remedy name starts with B. Suddenly vanished from my mind. Yeah, uh, is Berberis vulgaris. But not that. There is another one with urine with deep orange red color. And also it is suited for gout. Gout also. Can anyone help me? Which is that remedy with B? Given for gouty pain, and its indication is yeah, benzoic acid. Benzoic acid is another one. So in case of lobelia, there is a deep orange rich red color urine with copious red sediment. And the back, the sacrum is extremely sensitive. They cannot bear the slightest touch, even of a soft pillow. Sits leaning forward to avoid contact with the clothes, like picric acid, zingamet, then um, theridion, similar, and yeah. Theridion, these are the main important drugs in which the back is extremely sensitive and the person can't even touch it. So these are the symptoms of in case of lobelia. And the general modalities is aggravation from the slightest motion, touch or cold, especially the symptoms of dyspnea. But whenever there is a chest pain or a congestive sensation in chest, it is ameliorated by walking rapidly. When I say this symptom, the chest pain or congestion ameliorated by walking rapidly. And I also told that dyspnea, it is aggravation from slightest exertion. Okay. And now there is another remedy in which dyspnea is ameliorated by uh, violent exercise or even dancing. You know which remedy is that? Dyspnea ameliorated by dancing.
Sepia.
Yes, Sippy. So understand that difference. In case of lobelia, But there is no other connection, okay? The constitution or the other symptoms, no other relation, only with this symptom. In case of lobelia, dyspnea is aggravated from the least exertion, but in case of lobelia, they have the congestion or the chest pain, which is ameliorated by walking rapidly. And in case of sepia, there is dyspnea, which is ameliorated by violent exercises or rather dancing. And in boric materia medica, we see that this remedy is a vasomotor stimulant, similar to veratrum, similar to epicac. This one is a vasomotor stimulant, mainly acting upon the pneumogastric nerve. So similar to the action of even antiplaque. Increases the activity of all vegetative processes, but producing a depressed, relaxed condition with oppression of the chest and the epigastrium, where there is an impeded respiration, nausea, and vomiting. So there is an increase of vegetative process, but when we come to the level of the chest and epigastrium, there is a oppression of breathing or the suffocation, what we see, and associated with that, the nausea and vomiting. So the general indications which we have to remember in case of nausea, like for your clinical purpose, there should be the nausea, vomiting, dyspepsia, along with that the cold perspiration, the languor, the relaxation of muscles. Best adapted to like complexion people, suppressed discharges, and also catarrhal jaundice. This catarrhal jaundice, you can connect the nature of the urine they were having, the dark colored one. And in JH Clark, mostly I think I had kept only 3 cases. Yeah, 3 cases. But if you take JH Clark, lobelia, they're given a lot, 8 or 10 cases. I felt all the cases are very long, a lot of symptomatology being given. So I just kept only 3. I don't want to bore you more than that. But later you can go and read in J.H. Clark the cases that were cured with this remedy. So in J.H. Clark, it has been given that according to Hale, this plant was used by the Indians as an emetic, in the same way as Veratrum alp was also used. Lobelia inflata probably obtained the name of Indian tobacco because of its similarity of tobacco in producing intense nausea, vomiting, depression at the epigastrium, and the final collapse. So the case number 1, it is explained by Cooper. He never got any good out of Lobelia inflata, and then a herbalist advised him to use Lobelia in combination with common vinegar. So he stated one of the cases, a young woman, 23 years of old, and she was having a family history of tuberculosis. So the respiratory complaint is there, and tuberculosis on both sides. Um, when 14 to 15 years old, there is severe pain in left and sometimes right, and also round lower abdomen with that faint feeling. So we get those symptoms, the respiratory complaints, the faint sensation in the abdomen. This lasted till the monthly period came on regularly, and then she was well till 20. When diarrhea came on, which nothing was able to check, and which kept her in bed for months at a time. Because there is a connection that this medicine will be having some of the other conditions. Yeah, this is the sentence. The dyspnea or the nausea occurring in connection with imperfect menstrual evolution. So if a patient is complaining with some menstrual complaints or menstrual history which is imperfect, and along with that they have dyspnea or nausea, lobelia is better indicated. So these cases are actually mentioning about that. So the lady had the TB history, the sinking sensation, but still she went on. But then there were symptoms developing, because until her periods came regularly, she was all okay, but then it got suppressed. So we'll see the symptoms, the pain all around abdomen and up the back, much aggravated after undressing, cannot bear anything to touch her. We saw that in their back symptoms. 4 or 5 motions daily when taking medicine. If she leaves it off, continual motions all the day. It literally runs from her, that is the stool, which will be watery, sometimes light colored, sometimes dark, but never bloody. Menses became very irregular, sometimes 5 to 6 weeks in between. All symptoms, especially diarrhea, aggravation then. Since the illness began, the patient also had complaints of neuralgia, one or the other side extending to chest and suddenly getting worse. In spite of the treatment of all kinds, she grew worse. She went into a hospital and there was a small piles also or hemorrhoids which was removed but with temporary relief. And after this, the vagina as well as the rectum began to discharge copiously and excoriating fluid. So lobelia inflator was given 8 drops 3 times a day, and then she began to improve at once and in a few weeks was quite well. So this was the case given by Cooper, but here it is told that lobelia inflator. I'm not sure what is this notation AC is indicating, but could assume that it is not just lobelia, but it was mixed with common vinegar, and then it was given 8 drops 3 times a day. So that is one case, and this is another case. A lady of 52 when 37 was exposed to severe chill, which checked the catamenial flow. When we read the first sentence, we will be thinking about pulsatile actually, the cold exposure, checking the menses or control, suppressing the menses, even for graphitis. But after this, she had threatened thysis or the tuberculosis with bronchoria, which after 2 years gradually went off, leaving her subject to severe seizures of vertigo. 9 months before coming under Dr. Cooper, she felt as if something was forming in the uterovaginal region, causing much bearing down. She was obliged to go to bed, and then there occurred profuse pouring away of apparently serous fluid from uterovaginal region, which is very much burning and scalding and aggravated in evening. Vagina was swollen, extremely tender. Urination was very painful. She was unable to sit up, and decubitus could only be maintained with the knees drawn up or on the left side. When we read just this sentence, we may even think of medorinum. At night, she would be awoke by finding her back resting in a pool of water, and the sense of uterine bearing down was almost intolerable. The bowels were unaffected, urine free from all, but the only trace of albumin was there. For her also, the lobelia inflata, one third drop every 4 hours was prescribed. And after to that, the patient didn't have to be kept, otherwise she was always bed bound. But after this lobelia inflator being given, she didn't have to keep attached to the bed or bedridden. All her symptoms cleared up. But then she had some bearing down sensations from the uterine vaginal region as obvious from her discharges. So lobelia inflator was also assisted by natrum chlor, 1/3 drop doses occasionally, and that relieved the bearing down also. So even this condition, the Cooper is mentioning is at what I told, the dyspnea in connection with imperfect menstrual evolution. In the bronchopneumonia of childhood and in imperfect recoveries from chest infection, especially when there was a history of tuberculosis, lobelia is indispensable. Treatment with lobelia should always be begun with a single dose because, as we already told, its action on the pneumogastric nerve, and it can also cause that relaxation or all the respiration, everything being depressed for a while. So, if it is given too much, it can produce violent depression, especially of the respiratory and the CVS. In veterinary, I don't know how much it will be effective. In veterinary practice, it is said to have proved curative in the tetanus of horses, a disease it is also said to produce. This I saw only in Clark, not in Allen's or Boric. Guernsey gives this as a leading indication when found prominent, that is, the urine has a deep red color and deposits a copious red sediment. Then another case is of Broderick, young lady, 18, ill 2 years and under allopathic treatment. Her symptoms are labored breathing, a sensation of tightness across the chest, compelling her to take deep inspirations, and which cause pain in the heart region. Pulse is very full, rapid, cough after each deep breath. She is unable to lie down, and there is twitching of muscles of face. Menses never regularly established. Would go several weeks over time and then would last only a day. Lobelia inflator 3x was given. After the second dose, she went to bed and slept. The remedy was repeated just before next menstrual period. She had no more attacks and menstruation became normal. So even though in Allen's or Doric we have not mentioned it, just remember this point. If she is having that respiratory complaints, the dyspnea, or even the nausea or indigestion complaints, it is having some or the other connection with some menstrual complaints, some imperfect menstrual evolution. So I have mentioned only three cases in which we see varied symptoms. And when we are going through the symptoms, when I read it, I'm very sure many of the drugs might have come into your mind at that time. But the main indicator, what I could find over here is in all these three drugs, three cases, the common thing was there was some or the other connection with the imperfect menstruation. So in repertory, these are some of the symptoms where you can find lobelia. There is anxiety associated with respiration, which is impeded. There is fear of cancer. They are very fastidious. Not sure how much this should be followed. So in case of lobelia inflator, there is nervous dyspnea with anxiety. The person is extremely anxious about his health. He is having fear of cancer. They are extremely panicked and even leave the theater because of their anxiety. There is dyspnea, which is aggravated in anxiety, vexation, cold air, labor, or the slightest motion, slightest exertion, one foot lying down, going up or downstairs. This we have already discussed. Sensation as if heart would cease or come to a standstill. Deep-seated pain at the base of the brain, but base of the heart also. Deathly nausea with vertigo and vomiting, especially after hot food. There is morning sickness. The stomach emptiness, sinking sensation extending to the heart region. Can be useful in emphysema and prickling in skin. Vomiting with cold sweat. Aggravation from cold bathing, suppressed menses, tea, change of temperature, and amelioration from beer. So I told you there is an aggravation from drinking, right? They do have that alcohol intoxication being an aggravating factor, but they do have an amelioration from beer. I don't know how it happens. Desire, coffee, fat, and sweets. So that is about lobelia. Put in short, there is dyspnea going to the level of even suffocation, nausea, vomiting with prostration and cold sweat, and the dyspnea, which is aggravated from least exertion, least motion, going up and down the stairs. There is a congestion that can be felt in the heart region due to the rush of blood to the heart, and at that time, the patient feels much amelioration from walking very speedily. Then all the dyspneic complaints will be having some of the other relation with the imperfectly evolved menstruation of getting it suppressed. And in urine, if the symptom is there, it is much characteristic that there will be red sediments in the urine or appearing orange in color, red orange in color. So that is about Lobelia inflata or the Indian tobacco, the drug which is much similar to Epicac, Tabacum, Veratrum Arsal, Antimtat, Nux vomica, and also digitalis. In digitalis also we have the symptom, there is a sensation as if the heart would come to a standstill, or we say don't go in case of digitalis. So such a symptom also we can see in case of lobelia. The second medicine for today is lysine or hydrophobinum, lysine or lysinum or hydrophobinum, which is of course a nosode. So it is the nosode of rabies, or that is taken from the saliva of a rabid dog. This was actually proved by Herring. Trituration of sugar of milk saturated with the saliva of a rabid dog. Trituration might also be made of Pasteur's strongest virus. In case of lysine, I think these are the symptoms taken from without cause. Because some of the slides is not prepared by me, it is being already present. So I was told that it is being taken from without cause. So in case of lysine, there is a violent temper and fear of water. So we have the symptoms much similar to a person who has developed rabies. That typical symptoms we can see in the medicine lysine. So there will be a violent or very hypersensitive person with characteristic fear of water. There will be lysophobia, or the person will be fearing that he will become mad. Mental emotions or mortifying or bad news will always make him worse. He is very violent, impatient temper, impelled to do reckless things. Like the exact mad or the rapid features a person shows in whom rabies have been developed. Decide to throw the child out of window, or very attacking in nature. They're very rude, abusive, bites and strikes. In that condition, we can remember about Lacaninum, Stramonium, Belladonna, etc. Reminds Stramonium, yeah, but lysine has more verbal violence, rapid, hasty speech, and also spitting in nature. They're very much fearful of water. Uh, Even like the stramonium, the water or something that is being reflected upon, a mirror, the light being reflected from mirror, or the light being reflected from a water body, or even the sun can be causing much trouble for lysina. So they have fear from water, from narrow places in a crowded area, the bright objects, mirrors, like in stramonium, animals, being alone, and something bad will happen. There's always an anticipatory anxiety, feeling of being tormented, especially by someone on whom he depends. Very sympathetic, they can paralyze when they see suffering. And in physical symptoms, it is mostly affecting the nervous system, the throat, and also sexual organs. In the throat, the symptoms are similar to what we see in the rabbit patient. There will be spasm. He can't take water. That will be aggravating his symptoms. And in sexual organs, as we say that there is hypersensitivity of all symptoms, even in sexual organs, we can see the person will be highly sexually active. There is an uh, increase of acute senses, or the what I told, the hypersensitive of all sensations, the noise, that the person will be extremely sensitive to noise, light, odors, bitter taste in mouth at night, spitting constantly, convulsions and spasms, the symptoms in the nervous system, which are brought on by the dazzling light or the reflecting light, the mirror, etc., or sight of running water. Convulsions from strong odor, noises, light. Cannot bear the heat of the sun. So, in case of a person who is having even, which is that complaint, migraine, if it is coming from the heat of the sun, and then obviously the migraine patient will be having hypersensitiveness to odor, noise, light, etc. You can think about this lysine And sometimes when they are having that migraine pain, the only amelioration the person will get is when he or she is lying down in a completely dark room very quietly. But anything, slightest noise or the light is going to make them hyperactive. Hyperactive in the sense they're going to be very violent in nature. There is difficult swallowing, gagging on swallowing water or pills, choking feeling in the throat during agoraphobia. There is bluish discoloration of the wounds. When we say bluish discoloration of wounds, uh, is there any remedy that comes to your mind?
Lachesis?
Yes. So we have some lachesis symptoms also. Better of it is coming in further slides. Irritations is ameliorating gastric problems, that not much important. Hearing or seeing running water is an aggravating factor for them. The sight or sound of running water or pouring water aggravates all complaints. Exposure to sun is aggravating. Amelioration from bending backwards, gentle rubbing or hot water bathing. Desire for strange things during pregnancy, salt and chocolate. Aversion to water, apples. Then in Allen's knot, it is more or less the same symptoms. So the sight or sound of running water or pouring water aggravates all the complaints. There is a lysophobia. The person is fearful of becoming mad. Bluish discoloration of wounds like in lachesis. And usually the complaints resulting from abnormal sexual desire. Mental emotions or mortifying news, always making worse like gelsemium. And if it is like a pleasant news, it will be cophia. But here it is the bad news or mortifying news which make him aggravated. Cannot bear the heat of sun. Convulsions, which we already told. Convulsions can come from reflected light or even thinking of fluids of any kind, not just the water running sound, etc. Even if he's thinking about that, that thought can even bring about the convulsions. That's why they will be having extreme fear to that water. The spasm in the esophagus can take place. The exact rabies symptoms from slightest touch or current of air. Headache from bite of dogs, whether rabid or not. Chronic from mental emotion or exertion. Aggression by noise of running water or bright light. There can be also the saliva, which is tough, ropey visit with constant spitting in nature, but not important in a clinical wise. But yeah, the throat symptom is very important. The sore throat, where there is a constant desire to swallow, but with difficulty in swallowing. Even spasm of esophagus from swallowing the liquids. Gagging may be produced when water is swallowed. Constant desire to urinate and also to defecate on seeing running water. Urine is candy, cloudy, and contains sugar. The prolapse uteri, this is an important symptom. We may tend to forget because when we see the Lyssin symptoms, we see mostly a person who is having the rabies, that characteristic attacking mental feature, the hypersensitivity, the sight or even thought of water aggravating the symptoms, the uh, reflected light causing an aggravation of symptoms. So when we think about all those symptoms, even the spasm of the esophagus, we tend to forget the prolapse uteri complaints. But this is under, given in a single sentence, but this is very important. Lysine is having the prolapse uteri. Many years of Many cases of ear standing has been cured. And in some of the textbook, we can see that in case of lysinum, we do have uh, a, a Barrington sensation, the uterine prolapse. Along with that, a sore sensation or a sore tender sensation in the uterine region. Do you remember any other remedy that we have discussed with the same feature, where there is prolapse uteri and also uh, uh, sore tender sensation or a conscious sensation of uterus? In the last class, we did a lot of comparison with the prolapse uteri.
Hello,ness.
Yes, Helonius. And another remedy will be murex, and this is lysinum, where that the conscious sensation of womb is always there. And in the previous class, I have told you, and that has been mentioned by Kent, I guess, because whenever we are normal, we don't have any disease, all our internal organs are functioning. The heart is pumping the blood, the kidney is doing its filter job, the filtration job, GIT is doing its digestion, absorption, and waste formation. Detoxification process is done by um, liver. Even the lungs is doing the aeration, uh, and we are not conscious about it. We don't even recognize that such things are going on. And the moment we start recognize that, yeah, it is happening, which means some or the other problem have started. So we never know the presence of a uterus. And if we are, or if the person is understanding there is a conscious sensation of womb, then the problem has started. So in Alinsky, they have mentioned only prolapse uteri, many cases of years standing cured, but in some of the other book, it do mention about that conscious sensation of uterus. There is sensitiveness of vagina rendering coition painful. Do you remember any other remedy? Dyspareunia, very characteristic. The sensitivity causing the coition painful.
Sepia.
Anika.
Eh? Sepia and
Sepia.
arnica.
Yeah, sepia. Anika,
Uh,
maybe the aversion of prostration, protrude, something that will protrude, something like that.
hmm. uh, More than that. Sepia, they do have, yes, this sensitivity, but mentally also they are not interested. They are having aversion to sex. But there is another remedy which we discussed the same sentence, the sensitivity of vagina. The person, when even for a gynecological examination, we do on her, she will be going into a spasm. That much hypersensitivity. It's platinum. Sensitivity of vagina rendering coition painful. Do remember, okay, it's platina. And there is another one. If this coition is becoming painful due to dryness of vagina, do you know which remedy is that?
Not me also have, right?
Which one?
Natrium muriaticum.
Natrimuretica. Yes, another one. Could you say the more characteristic one?
Alumina.
Not much. Not the drug that I wanted or that characteristic, because I had taken only one important drug with that symptom. Starts with L. Then we will never think of, but very important. We always think lycopodium as only for male impotency, but dryness of vagina rendering the coition painful. Lycopodium is one of the most characteristic or important remedy. And if it is due to the sensitivity, Even the touch getting into the person into spasms, and it is platina and lysina. Then the same aggravation, carriage riding is also an aggravating factor. And in case of boric materia medica, the complaints are coming from abnormal sexual desire, affect principally the nervous system with aching in bones. Not much important. The aching in bones, I won't say you to remember. Curvatures brought on by dazzling light or sight of running water, hypersensitivity, uh, uterine sensitiveness, consciousness of womb or helonius. And now I have given a link actually, and this link is actually a news from 2018. Um, uh, uh, that in Canada, in British Columbia, one of they called a naturopath. It's actually a homeopathic doctor. She was a 4-year child was taken to her and who was having some behavioral disorders. He was also so hyperactive, attacking other people. And seeing that symptom, gave her, she gave that child uh, this medicine, Lyssin. And it wouldn't have known that much. But what the lady did is she put this case in her blog, and the blog got viral. So in that, you can later read it because if I have to go to the link means it will, I will have to stop this sharing and then go to the other sharing. So anyway, I will say in short what is that about. You can go later. So she had this baby who was brought because of the same symptoms that we told, like very hypersensitive, very attacking in nature, much rage, even biting others, even growling in the school. Um, so seeing that, she gave that medicine and she put it in the blog, and she explained what is actually lysina, that it is taken from the saliva of the rabid dog. And then, because it was in Canada, it resulted in a widespread problem for her. Even the health ministers and health authority getting so alert on that. How could she use this medicine, which is taken from the saliva of the rapid dog? So, what if the medicine, she says, because after giving the medicine, of course, if she has given it in the block, which means the medicine has been successful and the baby has improved from his that childhood behaviors, the abnormal behaviors. So, if the medicine has been able, that's what the health authority says. If the medicine have been able to cure the child from that problem, which means the medicine is having some or the other action, so this medicine being taken from the saliva of the rabid dog, it can also bring about other symptoms in the baby, like the rabies symptoms. So such a news you can read in this link later. Something about the case. When I was Googling, I just found it. I just put it over there. And this is given by H.C. Allen in his Materia Medica of the Nosodes in that book. So much of the symptoms are similar, something which I felt very different, which has not been mentioned that I told. So this medicine, it was introduced and proved by Herring in 1833, and 50 years before the crude experiments of Pasteur, who did with the serum. So when Herring did it, he got the exact symptoms. But when Pasteur did it 50 years later, because he didn't do any potentization, he did only experiments with the crude preparation, like Koch experiment with tuberculin. Many of Pasteur's cases were also fatal. But the homeopathic methods demonstrated not only to be accurate and scientific, but safe and efficacious also. So one symptom is lachesis is closely allied to lysina. There is aggravation from sun, bluish discoloration of wounds, irritability, aggravation from warm damp air, from touch or pressure, and aggravation after sleep. But what is the differences? In case of lachesis, it is mostly the symptoms will be evolving very, very rapidly. But in case of lysinum, the symptoms will be evolving very slowly. So it is the clock who explains that though the late evolution of lysine is in striking contrast with the lightning-like rapidity of the effects of snake venom. So symptoms much similar between lachesis and lysinum, but lachesis, because just remember the snake poison and immediately the symptoms are coming up. And in case, even if it is bitten by a rabid dog, the symptoms are going to take place, or they will be developing. Even the duration, the incubation period of rabies, we can't say. We always say it ranges, can be 1 week, it can be 3 months or 90 days, or it can be even years also. It depends upon actually the site of biting, and also how deep it has gone, what was the first aid treatment that was given. It depends on a lot of factor for the development of rabies as a disease also. So that's the difference, similarity of symptoms. But if we go for the evolution of symptoms, it is much slower in case of lysina, but much faster in case of lachesis. The third remedy for today is magnesia carbonica or MEC-carb. So common name is carbonate of magnesium, MgCO3. It's prepared by the trituration. Do you remember anything about magnesia carbonica or MEC-carb? Any magnesium remedies? Yeah, Vinod, you were saying something.
No, anything to do with milk?
Huh?
Okay, nothing. I just checking.
The gastro, a lot of gastro issue,
Gastric issues, yes.
and women, especially for women, issue, and also with gastro.
Yes, mostly gastric complaints, women complaints, and women complain more than magnesia carbonica. It is the other one, magnesium muretica. But magnesia carbonica can also be. But if you are going to make a select the best, the most prominent, and then between MEC-carb and muretica, magnesium muretica will be more prominent for female complaints. But nevertheless, all the magnesia remedies, including magnesia phos or MAC-phos, which is a very good remedy for dysmenorrhea. All these, they have the symptoms, gastric symptoms, and the female complaints. And magnesium muretica, especially for liver complaints and child. Those are the main sphere of action of magnesia carbonica. I mean, magnesia in general. So with magnesia cup or MEC cup, in Allen's keynote, we can see for persons, especially children of irritable disposition. So for persons, the children of having an irritable disposition, they're very nervous temperament with lax fibers, and the characteristic will be sour smell of whole body. Can you say me some other remedies with sour smelling of whole body?
The
Calcarea. Calcarea.
Calcarea cup, yes.
Rheum,
Yes, Ria. And the important remedy will be sulfuric acid. Even sulfur is there. Just putting the most important symptom medicines. Sulfuric acid. Okay, the whole body feels tired and painful. especially the legs and feet, aching and restless. It is even told that the person will be feeling very tired after waking up, or she is having an unrefreshing sleep. So the whole body feels tired and painful. There is spasmodic affections of stomach and intestine, indicating their gastric symptoms. Increased secretion from mucous membranes, which means or indicates the diarrhea. There is unrefreshing sleep, more tired on rising than when retiring. There is an inordinate craving for meat in children. Now, this symptom is very important. The inordinate craving of meat in children. Uh, and this is not just of this one, McCarb, it is a symptom of magnesia group actually, inordinate craving for meat. For the pregnancy related complaints, the heartburn, sour belching irritations. Okay, give. So, a good remedy for heartburn, but even that will be having that characteristic sour taste. Even belching, irritations, or whatever they say, it all tastes very sour. Even the vomiting or during the pregnancy, everything tastes so sour. There will be pain, neuralgic pain, lightning like. And this also we can connect to the magnesia group, the magnesia phosphorica, which is more characteristic. So the spasmodic pain, the neuralgic pain, it's a characteristic feature of magnesia group. Aggravation, especially left-sided, insupportable during the person when he is in a lying post. He should get up and walk about. There can be toothache during pregnancy, especially at night. The pain on vertex as if the hair were pulled. Clinically, I don't think it is much important. Then the menses is characteristic. It is preceded by sore throat, like lac canina. And all the associated or concomitant symptoms that is seen during menses is very characteristic because we told that already one of the action of the magnesia group of remedies is in the females. So the female reproductive system symptoms are very important. So before to the menses, there will be actually sore throat. Every month before to the menses, the patient will be having sore throat. The during menses, the pain will be like labor like, that much intense or terrible dysmenorrhea. Cutting colic associated with backache, weakness, and also chilliness. Flow only at night or when lying down, and ceases when walking. This is also important symptom. Flow flow only at night. And when I say, oh, already it has been given, but do you remember in case of Lilium tigrinum? In Lilium tigrinum, when we studied, we saw that the menstrual blood will flow only if she is moving about. So here it is opposite, makeup. It is flow happening only at night or when she is lying down, ceases when she walks. That is another remedy similar to that is ammonium mure and creosote, all the syphilitic remedies. Macabre also, some are syphilitic because there is diarrhea or the mucous membrane being affected, the secretions are coming out. So we can see some destruction is happening. So it is also a syphilitic tendency. Yeah, ammonium mure, creosote, everything is having a syphilitic tendency. So those remedies, they are having this flow only at night. But in case of Lilium tigrinum, causticum, it is when moving about. Acrid dark pitch like this will be the menstrual discharge, and it is very difficult to wash off. This whole sentence is very important in case of MECCA female. And in diarrhea, you know the gastric symptoms. So there will be a colicky pain because we already told there is a spasmodic pain. There is a neuralgia that is associated. So definitely, in case of diarrhea, also there will be cutting or doubling up colic or the colicky pain, which make the person to double up. And the most important symptom will be its duration or the periodicity. It occurs regularly every 3 weeks. This is important even for MCQ or even for your short question asked on MECA. The diarrhea, which is happening periodically, like that is every 3 weeks, it is important. The stool will be green, frothy, like scum of a frog pond. This semile in which it is given, how it is looking. So even in chamomilla, as if the spinach, the green spinach being cut. So this similarity, this comparison being done with the stool that is green frothy like the scum of a frog pond, that's also very similar for an MCQ basis. Or sometimes it is not green and frothy like that of a frog pond. It can be whitish. Tallow-like masses are found floating in the stool. So something that small masses of milk or the coagulated milk can be found, which indicate even milk is intolerant for them, or the milk passes undigested in nursing children. When crude magnesia has been taken to sweeten the stomach, if the symptoms correspond, the potentized remedy will often relieve. Now, can someone explain me what is the meaning of just a guesswork also you can make? What is the meaning of this sentence? When crude magnesia has been taken to sweeten the stomach, if the symptoms correspond, the potentized remedy will often relieve. Any guess?
That means discomfort after the crude magnesia, is it?
Hmm. Like in the earlier times, we have seen that whenever we say about the skin complaints which have been suppressed by sulfur or mercurius, likewise remedies, one of the older type of treatments, whenever the patient complained about acidity, because we saw that the patient will be having sour belching, etc. So whenever they had this acidity, to sweeten the stomach means to neutralize that acidic nature. That is the mean. I put it in the quotations, sweeten the stomach. It is not that something has been given to sweeten it, nothing like that. When there is an acidity, to neutralize that effect, that is the meaning, sweeten the stomach. So at that time, when the patient used to come with this gastric complaints of acidity, etc., the treatment that used to be given was the crude magnesia. Just the magnesia to be given in crude, not the potentized form. So whenever the patient comes, they go on giving crude magnesia, and finally, a kind of not the pathological proving, we could say, not the actual drug proving that we do, but its symptom also start appearing when it is being taken in larger doses. So if we get such a history that the person was having acidic complaints and he was frequently taking crude magnesia, and then maybe most of his symptoms that now we see, or when the patient is coming to us, it will be due to this too much intake of crude magnesia. So if the symptoms are correspond and we give the potentized remedy, this complaint will be going. Even that acidity complaints and also the negative effects that was produced by giving excess of magnesia, that also will be vanish. Aggravation from change of temperature, notice this every 3 weeks. Aggravation from rest, that's why the person we saw that is having complaints, especially when lying down. Milk and also during menses. Amelioration from warm air, but is worse in the warmth of bed. In case of boric material medicare, much are the similar symptoms. There is gastrointestinal catarrh with marked acidity, often used with advantage for people who have been taken this drug to sweeten the stomach. Sweeten the stomach, in other words, it means uh, neutralizing the symptoms of acidity. It is frequently indicated in children whose body smells sour and very sorry today and disposed to boils. The broken down, worn out women with uterine and climatic complaints. There will be numbness or distension in various parts, nerve prostration, sensitive to the least start, noise, touch, etc. There is tendency of constipation. We saw diarrhea every 3 weeks, but also there is a tendency to constipation after nervous strain. Sensitive to least touch. There is intense neuralgic pain. What I wanted to show was this one, ailments from complaints with the wisdom teeth. So another remedy is Chirianthus. So if you're having some complaints with the wisdom teeth, uh, one of the medicine that is been told in homeopathy is to take Chirianthus, and mostly Chirianthus is taken in tincture or very small potencies. So if there is any complaint associated with wisdom teeth, and that resulting in many other complaints, because if it is wisdom teeth, nowadays what we do is we usually go to the dentist and actually pull it out, and there ends the problem. But mostly if it is affected or if it is decayed, then the nerves connected, the neuralgia might be there. So we already saw this medicine or these patients will be having neuralgic complaints. So the problem related to wisdom teeth, we can think about MECCA. And in case of relationship, the complementary relation we can see in case with chamomilla. The nature of the diarrhea, the neuralgic pain. In chamomilla, we say the person is sleepy but can't sleep. But here it is the person will be feeling more tired when she's or when he or she is waking up than going to retire. So the complementary medicine for makeup will be chamomilla. So this is from uh, 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 with Orcas actually. So there is a gastrointestinal complaints with acidity. In mind, there is forsaken feeling, feels he or she is not loved by parents or friends. So in coming up slides, you can see some pictures that I have taken from some of the books. And I will actually share that book with you. It's only very few drugs in that. It's about homeopathy remedy pictures. Something is the name of that book. But in that, both magnesia carb and magnesia mure, it is saying about that forsaken feeling, that it is mostly indicated in children who are living in orphanage, and the complaints thereby arising. So they have this feeling that he is not loved by parents or friends, and that resulting in various symptoms in the physical and mental levels. And that book actually says how that evolution is taking place. There is irritability in children. In physical plane, there is gastrointestinal disorders with marked acidity, sourness, which I already told, all the discharges will be having that sour smell. Menses is more copious at night. Flow comes only after the pain. And coryza before and during menses, and also sore throat preceding. Aggravation from milk, it will be passing undigested. There will be unrefreshing sleep. There is trigeminal neuralgia or pain along the course of the trigeminal nerve, that is the along in this jaw area. Aggravation left side, lying, night, rest, sitting, and amelioration, walking, motion, pressure, open air, etc. Abdominal distension ameliorated after passing flatus. Stool is frothy, green, like a frog scum. Lyenteric stool in children. You know what is the meaning of lyenteric stool? You can see that even in abrotanum, Leinterix tube. Means feces mixed with undigested food. That is Leinterix tube. Feces plus undigested food. The Leinteric or Leinteria means feces plus undigested food. Modalities aggravation is during menses, pregnancy, night lying after, amelioration open air, walking, motion, and desire. We saw that they have an inordinate craving for meat, especially in children, bread and butter. And intent, like all other magnesia, it has most violent neuralgic pain, pain along the course of nerves, pain so violent that he cannot keep still, and he moves about and is relieved by motion. The prover felt these pains mostly in the head and face, but clinical experience has demonstrated that it has violent neuralgia everywhere, even in the abdomen, the colicky pain. We are justified from the proving in considering it as specially related to the left side of the face, the trigeminal neuralgia, driving him out of the bed, keeping him in constant motion. As soon as he stops moving, the pain becomes very severe, shooting, tearing, and cutting. So yeah, this is the picture book that I have taken some pictures only. I didn't go for the development of the symptoms in this drug, but I'll share that book with you. You can see. So it's just pictorial representation. So we can see that there is a forsaken feeling in children that may change their behavior. There is rejection of or support of aggressive behavior. So they can go to the two extremes because of this forsaken feeling. Either they go into a very silent nature or they may go into a very aggressive behavior. There is fear even to anything or ghost or whatever during the day, but at night it is very peaceful in the ameliorated in the evening and in bed. No fears at night. Then with this we told the unrefreshing sleep. The patient when wakes up will be feeling more tired. So tired and unrefreshed sleep after waking up in the morning. And then everything, every discharge, even the sweat smelling sour, that is what discharges smell sour, perspiration stains the cloth. Infants who cry a lot, there is a slow development. They thrive poorly, showing their difficulty with the nutrition. The menstrual flow only at night stops during the daytime. And here we have seen the trigeminal neuralgia, which is ameliorated by hot application and also pressure. That is what the presentation showing. Facial pain, especially on the left side, heat and pressure ameliorate. Then there is an aggravation from warm food. Next medicine is magnesia muriatica. Do you need a break here?
No, no need.
Shall I continue?
Yes, please, Dr. Mira.
Okay, so magnesia muriatica, which is magnesia chloride, muriatica, no, it is chloride, MgCl2, which is usually made by trituration. So in magnesia muriatica, we have most of the symptoms or some similarity with the MECAP. Here, the difference is there is a action on liver complaints. There will be some of the other liver complaints associated. So this medicine, Macmur, is adapted to diseases of women, spasmodic and hysterical complaints, complicated with uterine diseases, who have suffered from years of attack of indigestion or biliousness. So notice the different words that have used over there. Then that completes the drug in total. So it is says it is the disease of the women. And what type of women? They will be having some spasmodic complaints. The pain or any other complaints, it will be having that spasmodic nature, which we saw in McCarb also. There is that spasmodic neuralgic pain, and also in McFors also we'll see. So that's a feature of the magnesia remedies. So there is spasmodic complaints. And when we say spasmodic, it can be also colicky pain. It can be also the spasmodic dysmenorrhea and hysterical complaints. Uh, Definitely, the patient is having uterine diseases. So, uterine diseases, when they have the female or the lady is going to show some or the other mental, delusional, or hysterical complaints, and they will be having years of chronic complaints of indigestion or biliousness, indicating gastric complaints or the liver complaints. In case of children, if it is indicated in children, there is difficult dentition and are unable to digest milk. The symptoms which we saw in case of MECA. It causes pain in stomach and passes undigested. The milk, as like in MECA, causes pain in stomach and passes undigested. The child will be very puny. Puny means a thin child but with a protruded stomach. Rachitic, the ricket, the child who is having rickety complaint, and also who craves sweets. So they persist with weakness of liver and aggravation from milk. Here also, these medicines also they have the forsaken feeling, but they're more going for peace loving. They're intolerant of aggression, and they try to resolve the conflicts. Restlessness. There is anxiety at evening in bed on closing the eyes at night. Unconsciousness after eating or while lying. Liver affections is characteristic, whether there is inflammation or hepatitis, jaundice, and large liver. Unrefreshing sleep, like that in case of MECA. Aggravation from milk. Diarrhea, stomach or abdomen pain, or the indigestion. Undigested stool after milk, and where the milk will be passing undigested also. Periodic headache every 6 weeks. Now, not this point. So, in case of magnesium cup, we saw that diarrhea every 3 weeks, and here it is the headache which is every 6 weeks. So, remember the two different complaints. One is diarrhea, one is headache, and headache it is duration of 6 weeks, and if it is diarrhea, its duration of 3 weeks. More than clinically, it is important for the MCQ based questions. Um, and during headache, there may be vomiting and thirst. Eructations also present. Constipation during dentition. They feel very old rather than their age. They feel that they are very old looking, and they also have an old looking expression in the face. Adapted to diseases of women, spasmodic and hysterical complaints. Aggravation from milk, bathing in the sea or sitting in the seashore. Amelioration from pressure, open air, and motion. Desire does not know what desires, but usually sweets. Okay. According to Kent, it would seem rather strange that the two remedies to which Hahnemann gave such a good start by proving and use should be so neglected and forgotten as McCabe and McMoore have been. Uh, and seriously, that is true. Seriously, because when we go for a prescription, I don't know. Have you ever prescribed McCabe, McMoore?
No.
Yeah, and that's what Kent even told in that time also, which is very true even now. Macabre and McMoore, we see such a lot of symptoms, even the constitutional symptoms, the mental symptoms, but still we kind of prescribe very less. Maybe we see a woman with liver complaints um, in her 40s. The typical picture of a cholelithiasis patient, if you remember the cholelithiasis, though we see a woman in 40s who is obese, who is having complaints from fatty foods, and the complaints of cholelithiasis or the gallbladder, the liver being affected, maybe we think about muretica or magnesia mure, but it is very rare we think about MECCA. Uh, even in the constitutional way also, uh, I have never prescribed MECCA for any baby until now. But the symptoms are so common. But as Ken says, these remedies are neglected while phosphorus and sulfur are prescribed for almost everything. And true that is. There are so many other remedies which we think about when the child comes with the sourness or the diarrhea complaints or even the trigeminal neuralgia or any kind of neuralgia. We rarely think about MECCAB actually, true it is. These two, if used, would cure many of the liver troubles that are not now cured. McMore could cure many conditions in nervous, excitable women that now go uncured. And instead of this MECCAB and McMore, we are more concentrated with phosphorus and sulfur being prescribed for almost anything. Magmore is a deep-acting antipsychotic medicine suited to nervous patients with stomach and liver troubles. It has enlarged glands and irritation of the nerve centers and brain. The patient is very sensitive to cold chilli, but he still desires fresh air and open air. Many of the complaints are, and that we can connect with their chlorine, McMoor, that chloride part, like in case of natramure, the chloride part that they desire for the fresh air or the open air. Many of the complaints are ameliorated by the open, fresh air, but some head symptoms are an exception. The head must be covered as it is sensitive to the open air. Is extremely restless. Only with great difficulty can he keep still, and if forced to keep still, he becomes very anxious. Anxiety is the marked feature. Restlessness, fidgetiness throughout the body, and coupled with anxiety. This usually comes on at any time, but it is worse at night in bed and still worse on closing the eyes to go to sleep. When he closes the eyes, he becomes so anxious, restless, and fidgety that he must throw the covers off and take a long breath or do something. But then, when we compare in wake up is so that the child, in case of child, he is much having anxiety and fear during the daytime, but when he is going to sleep, he goes sleep peacefully. But in the physical plane, they do have complaints when lying down. So here we see in case of McMoore, even the mental complaints are getting aggravated or the patient is feeling so restless and anxious when the patient is lying down at night. He is kept awake at night by that anxious feeling. It was described originally by the prover as a feeling of uneasiness, but in the guiding symptoms, it is spoken of as a restlessness in bed. If you study the hysterical nature, the anxiety and restlessness, you will see it throughout the whole economy and should be classed under mind and nerves. There is anxiety in the room, ameliorated in the open air, anxiety at night in bed on closing the eyes. While reading, she felt as if someone were reading after her and she must read faster and faster, the kind of hysterical nature. That occurs in patients who are tired from being worked up to the highest pitch, and it seems as if they would fly to pieces. Any thought that comes into mind tends to repeat itself. The magnesia, this is what I took because it's a PDF. I just took a snapshot of this. Similar to magnesia carbonica, here also in magnesia more, we see a deeply rooted forsaken feeling in childhood in people who need more. The causes are similar. There is quarrel, the parents divorce, or the death of one or both parents. That's why mode of the magnesia group is indicated in orphan children. The mineral magnesia can show very strong reactions. It can aggressively withdraw oxygen from other elements, and it is, among others, used to build explosives or bombs. This aggressive behavior or complete suppression thereof may be seen in patients who need a remedy of the magnesia group. So this is how that doctrine of signature has been applied. Chemically, they show very strong reaction, either used as an explosive. So that aggression may be present, or there may be a complete suppression of that aggressive nature, and that shows the patient needs a one or the other magnesia remedy. So this is some picture. There is a strong forsaken feeling, often in early childhood. Ailments usually developing from quarrels between parents. There is a fear of losing care, love, and security. A strong sense of duty with which they hope to secure their place in the family or in society. And why this develops is because we saw that they have that forsaken feeling. Family is being in a struggle, they are fighting each other. So, most of the things they couldn't enjoy, or they couldn't have a good position in their childhood. And so, for a compensation, they want to give their best, their hard work, so that at least in their adult age, they will be having a good, respectable position at that time. So they will be very hardworking, having that strong sense of duty, and they believe that doing so, they will secure a place in the family or in the society. They can have ailments from disagreement with between friends, and whenever there is such a disagreement, what they usually want to have is actually a peace. So that it's a pacifier. There is a strong aversion to disagreements. Is a great peacemaker. There is a strong fear when lying in bed at night. As soon as they close their eyes, they get up and walking around ameliorates, opposite to that of makeup. Inflamed and painful liver, pain extending to back. Extremely tired on waking in the morning, feeling benumbed, like that of the makeup. In this feeling, we told that she will be feeling like she's become so old, feels old and exhausted, and there is abdominal pain from milk. Next remedy is medorinum. Should I continue or should I stop and give you some comparative work? What would you prefer?
I think medoranum is a big remedy. Shall we continue next week?
Can I give you some work, some comparison?
Comparison?
Or you want to take time for your study for the exam? What you prefer?
Yeah, I think yeah, I need time because I'm also not feeling well. I'm down with COVID actually.
Okay. I'm sorry. Uh,
Yeah, so I think I need to sleep for a while. I'm very
no
tired.
problem. No problem.
Yeah.
Is it okay for the others also? Shall I conclude?
Okay.
Yeah.
Yeah.
So these drugs won't be there for the exam. Only the earlier taken drugs will be there. And in case, because I was just, I think I'm explaining as much it should require. And for the seniors, it has been already done for you in the previous semester, so it shouldn't be much difficult. And for Farah, we will be doing the same medicines the next semester also. So don't worry, I go in detail at that time.
So Dr.
Um,
Ming, how will you test us on how is our test or our exam of this material medical will be is by case basis